The correlation between HPV infection and genital warts. As an introduction, HPV is the common viral infection that affects both men and women. It is a DNA virus of the Papillomavirus family and can be classified to low risk and high risk. The benign growths can develop on the skin or mucous membranes. For genital warts, the scientific name is Condyloma acuminata. It is a common sexually transmitted disease caused by human papillomavirus. It is typically flesh-colored and has cauliflower or smooth surface texture. The histomorphology of genital warts can be seen as follows. Cervical cancer is one of the most preventable types of cancer, yet it is the fourth most common cancer affecting women globally. Almost all cervical cancers are due to persistent infection of high-risk human papillomavirus, HRHPV. HPV-16 and HPV-18 contribute to 70% of all cervical cancer cases globally. In Malaysia, cervical cancer is the second most common cancer among the country's women aged between 15 and 44 years old. Prevalence for HPV infection in Malaysia is 14%, with high-risk type contribute for 10.7% and low-risk HPV 3.3%. The Chinese people are very highly affected with HPV, which is 75.5%, followed by Malay and Indian. The majority of HPV infection in Malaysia are HPV single-strand infections. The risk factors are those who are sexually active in young age, sexual behaviors such as unprotected sex and multiple sexual partners, weakened immune system, and lack of HPV vaccination. Generally, we can classify HPV into two classes, which are low-risk HPV and high-risk HPV. The most prominent difference between these two is that low-risk HPV is non-oncogenic, which is the one causing warts, while high-risk HPV is oncogenic, which is the one causing cancer. As mentioned earlier, low-risk HPV is warts-causing. There are many types of warts that is caused by this strain, which are common warts, plantar warts, flat warts, and genital warts. Each of them is caused by different types of HPV and shows different characteristics. Meanwhile, high-risk HPV-related cancers include oropharyngeal, vulvar, penile, cervical, and anal cancer. Genital warts usually show symptoms such as a cauliflower-like form created by a cluster of warts, caused by the development of HPV that infect the basal cell, which leads to unusual growth layering on the skin. Other symptoms include small, flesh-colored brown or pink swelling in your genital area, along with itching or discomfort, and bleeding during intercourse. In women, genital warts can grow on the vulva, the wall of the vagina, the area between the external genital and the anus, the anal canal, and the cervix. In men, they may occur on the tip or shaft of the penis, the scrotum, or the anus. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal or anal sex. It also spreads through close skin-to-skin touching during sex. For the HPV transmission pathway, first, there's minor vaginal tears and cuts. This is actually common and often occurs when a person is removing body hair or engaging in sexual activity. Factors that may increase the likelihood of vaginal tears include rough or vigorous thrusting of an object into the vagina, vaginal dryness, vulvovaginal atrophy, vaginal scarring or tissue damage, certain skin conditions, and some medications. Moving on, the HPV infection viruses invade and infect the basal cells through the small tears in the lining of the cervical epithelium. The viral particles opportunistically invade the cervical epithelium and infect the basal layer cells. HPV DNA replicates and maintained in the dividing basal. Next, the HPV virus initiates stages of the viral life cycle. This includes reactivating cell replication to produce multiple copies of viral DNA. Accumulation of cells disrupts the structural appearance of the epithelial tissue to look disorganized. The extension of this disorganization through upper layers and to the surface of the epithelium is what is used to classify the degree of the lesion. The immune defense system responds against HPV in several ways, first being innate immune response, and second being adaptive immune response. Innate immune response is the first line of defense against HPV infection. This response provides non-specific protection against a variety of pathogens and also enhances the adaptive immune response. Innate immune response involves macrophages, natural killer cell, and natural killer T cell. Adaptive immune response is the second line of defense via cytotoxic T lymphocytes targeting HPV protein. It eliminates cell infected with HPV by producing a higher rate of neutralizing antibodies to the most accessible epitopes. Currently, there is no treatment for the virus itself. However, there are treatments for the warts that is caused by HPV, which are medications and operations. For medications, salicylic acid is a commonly used medication to treat the warts. For removal of the warts via operations, there are a variety of ways, which are electrocautery, freezing, laser treatment, and surgery. For preventing HPV infections in the first place, the easiest ways to prevent the virus is by practicing safe sex, vaccinations, and regular health checkups. That is all. Thanks for watching.